My time at what was Light Orthodontics is the gift that keeps on giving. I've been lucky enough to work with some of the best in the business that have come through those doors. And I will always be forever grateful to the late and amazing Dr. Kogod, who brought me into his practice 9 months pregnant and very quickly generated a waiting list for the Simon Says clinic that I couldn't even keep up with. I now get to work with Dr. Armakan, the pediatric dentist at Children for Dentistry. He's a laser certified professional and expert trained provider in the release of tethered oral tissues. We've treated patients from across the lifespan, as young as a few days old, so fun, and even some adult SLPs from our Simon Says community.
Hi, everybody. I'm Dr. Armakan. I'm excited to be here and do a little presentation for you guys. And Simon Says, thanks for having me back again. I'm going to go ahead and share my screen here and hope you guys enjoyed today's presentation. And that's it. All right. So today's presentation is called Tethered Oral Tissues Treatment Throughout the Lifespan. And so for those who've seen me present before, I've presented a lot on functional frenuloplasties and kind of tapered that to child and adolescent populations. So I've shared a lot of cases in the past and kind of how we've been able to successfully do those. So today I thought we'd kind of touch on kind of the potential impacts and benefits and outcomes that we see on treating patients throughout an entire lifespan. So we'll do a few, case studies of infants, some in the child and adolescent population, and even those in a older age demographic as well. So again, thanks for having me, Jay and Simon Says. I'm super grateful and appreciative. I'm always honored to be here and share with you guys and be a part of this educational journey, as I've benefited from so many as well. So I hope you guys enjoy. A little outline for today. We'll just touch a little bit about myself. I'll summarize that in a little faster form. I won't drag that along too much. We'll talk about some of the impacts on different phases and different areas of tethered oral tissues and different age groups. Then we'll really delve into cases. That'll kind of be a bulk of the presentation. Show you a little glimpse of some other things we're up to in our practice and things that are being researched and definitely showing potential impacts as well that can help these patients as well who are going through some of the struggles that we're encountering. And then I'll just click through a bunch of additional cases and outcomes that I won't delve into too deep for you guys. If you're watching this later, or if you're watching a recording of this, I'll kind of click through those. That way you can pause and kind of observe if you want on your own cases, just so you can see the differences in patients' start and finishes, what things look like in the middle of the appointment. And those I'll click through fast so you can kind of slow down and pause those in the video if you want. But we'll delve into the cases together as we go along. So this is a little bit about me. I'm a board certified pediatric dentist. I have a GPR experience, which was oral surgery based. So I was based out of a hospital that did primarily oral surgery. Laser certified. I've kind of worked with the whole spectrum of different dental lasers that are out there. I'm an ambassador of the Breathe Institute. So I've done some TOTS training through Autumn Henning. I'm a graduate of the Tongue Tied Academy. I've done the Airway Health Solutions pediatric mini residency. I'm a member of the Airway Circle. What else? I've graduated from Tufts Pediatric Dental Sleep Medicine mini residency, and I'm currently graduating in April, hopefully, from the Breathe Institute's MyoMasterminds course out in California. And so I've kind of thrown myself deep into this airway and tethered oral tissue space, obviously getting all the different perspectives I could and kind of helping formulate my own experience into that and trying to just help my patients in the best way possible. And it continues to evolve. This is my office team. Zen, our little therapy pup. If you've been here, usually on Tuesdays, sometimes Mondays he's here, but he's our little office pup. Gets to hang out with us and patients if they want him. This is our clinical team here in the photos that you see to the right up at the PD conference in our office. If you've had patients with us, some of your patients and yourself have worked with probably any or all the people on this team. And so they're the group that I rely on heavily, and I um, couldn't do a lot of what I'm doing today without them for sure. They're a big part of this process. So they're a part of this educational journey and just kind of keeping me going in the right direction. Um, to summarize, I'll go back to that. I just, the team shared a little video of me just to kind of give you a sense of my kind of MO and personality and the way I am as far as education and being playful and the things that I'm into. And I thought I'd share a little funny birthday post that was this month that they posted on social media. If you're not following our page, I just thought it's a good 30-second summary of the type of person I am. And then we'll move on to some more sharing of knowledge and cases. So I just thought I'd show you that funny video coming up here. My family there, us doing some marketing, Helen, one of our clinical assistants, Rosie, another clinical assistant, Andrea, clinical assistant, and Ashley. That's my family, my 3 daughters. A lot of team outing time and family time and some fun and sports mixed in there along this kind of clinical and educational journey. So you get a little sense of our kind of flavor of trying to keep things playful but pretty intimate and a close-knit group and team. So treating adults, some sports activities, stuff outside the office. We're a big soccer family. Our kids are all soccer players right now. Visiting schools. There's Zen helping me out as I'm the patient, me treating me. That's me presenting at the American Laser Study Club's annual Breathe and Thrive conference, which I presented at the last 2 or 3 years. So some fun stuff. All right. So now on to some of the impacts. Let me get this off here. So as we look at tethered oral tissues and we look at the impacts, we'll kind of start with, and this is not all or limited to, but just some of and many of the things that can be impacted by different tethered oral tissues in the mouth, whether it's their lip, their tongue, their cheek, and kind of specifically looking at infants and the infant mother dyad early on. So for mothers, that could be painful nursing, creased or flattened nipples, blistered or cut nipples, incomplete breast drainage, plugged ducts or mastitis, inability to nurse without using a nipple shield, decreased milk supply. For the babies, that could be them having a poor latch, poor weight gain, reflux or frequent spitting up, frequent gassiness or fussiness, clicking or smacking noises when they're eating, dribbling milk out of the mouth, frustration when eating, inability to hold a pacifier, or prolonged nursing or bottle feeding sessions. So this is infant and mother and the infant mother dyad, some of the feeding specific challenges that we see early on in those with tethered oral tissues. Impacts on children and then going into the adults. So for speech, we see frustration with communication. We see difficult time being understood. Sometimes patients have a difficult time speaking fast. They can have speech delay. There can be stuttering, mumbling, specific sounds, and enunciation that can be challenging. THs, Ls, Ws, Rs, CHs. Feeding issues we see frequently are just frustration while eating, difficulty with solids, either transitioning from liquids to solids or even just with solids as a whole, even as they get into adult age, grazing on food throughout the day, choking or gagging, being very picky eaters, and then sometimes even packing foods inside their cheeks. So this is in the speech kind of realm and feeding realm. And then the other areas we kind of focus on are sleep and other kind of postural anatomical impacts. So for sleep, we can see alterations in sleep position frequently. We can see them kicking and flailing at night, waking up easily, bedwetting, waking up very tired in the morning, snoring, bruxism, so they're grinding their teeth. Sorry about that. Sleeping with their mouth open, gasping for air, which kind of can be an indicator that maybe there's potential for sleep apnea, which we would confirm with other testing as well. And then we can see neck and shoulder pain, headaches, migraines, TMJ pain, clicking or popping in the joint. They can have ADHD or hyperactivity, a difficulty with attention. They can have a strong gag reflex, mouth open during the day, so not just at nighttime, but also daytime issues with their mouth being open. They can have enlarged tonsils or adenoids or have a history of having them removed as we look at older patients. Ear tubes, so having a history of ear tubes, if they had recurrent ear infections and they've been on treatment or it's failed many times, they can have history of recurrent ear infections. Reflux, so history of reflux or current reflux, constipation, difficulty brushing their teeth or keeping their teeth clean, diastema, particularly in the anterior, so in the top front or bottom front area, and then sometimes postural concerns, so issues with posture, kind of maintaining a straight upright posture, back curvature being excessive, slumping downward. So these are different areas that we see impacts of tethered oral tissues that could be impacting areas beyond just that early feeding window. Babies, just showing you some of a quick glimpse, but we'll see some specific case studies. But these are some of our sweet little babies we've treated throughout the years. And we've kind of been seeing patients in this space for almost 8 years now. And so we've tried to follow the research and best recommendations on how to do these. And those have evolved and improved. And you'll see some of these babies have tongue releases, some have lip releases, some have tongue and buccal releases. So there's different areas and tissues in the mouth that have different impacts that we're observing and looking at. But all these patients treated in our office, quick appointments, pretty uneventful, but could have such a big impact on them. And we're excited to be able to do that. Case reviews. So this is where we'll delve into some of the case reviews a little more deeply. And so you can see just a few cases of how things have been impacted and the outcomes and why we did some of these patients, and all of them having, very different reasons. So our first patient is a 54-year-old patient, had a previous frenectomy by an ENT about 3 years ago. Patient reported that it did not feel beneficial afterwards. Patient still had a lot of sleep issues and challenges, specifically kind of breathing while sleeping, and a lot of neck and upper back pain. And so the patient was also seeing another airway focused provider and was using a Vivos appliance, which was a nighttime appliance. There's different appliances, but they were using one at nighttime to kind of help bring their lower jaw posture forward to allow a little less compression into their back airway. So their kind of tongue and lower jaw falling back in their airway, contributing to some sleep challenges. And it's potentially helping with some expansion, while at the adult age can be extremely challenging with just an oral appliance, but in theory, some potential improvements in oral cavity and airway. So the patient was having pretty good results and became pretty dependent on the appliance and felt like their sleep was better. However, they still felt pretty restricted and tight. So they'd been in myofunctional therapy for about 6 months at this point when we did the release. And so this is some photos over the course of time. So this is how the patient came in initially after already having a release with the ENT. So we classified this as a kind of a class 2 or class 3 lingual frenum compensating to a class 2, probably, meaning that in true it's about class 3, but the patient is using a lot of neck muscles and engaging their floor of their mouth and jaw to kind of make it seem like a class 2. We did a release here, pretty small opening, just enough to make sure we got good, comfortable elevation, a release of that tension. This was a functional frenuloplasty. We did suture the wound closed, and this is a 6-week follow-up. And so lot of improvement. Patient felt much better tension-wise. They're continuing to wear the Vivos appliance, and they actually started to get some spacing, even though they had previous orthodontic treatment. The Vivos appliance did start to create some dental spacing, so some improvement in their size of their oral cavity. And so they started having great improvements. So this is a patient with, breathing issues and neck and posture pain kind of later in the lifespan, 54 years old, going through this process, yet having significant benefits from it. Our next patient is a 6-year-old. This patient has been in speech therapy for 4 years, so for majority of their life. And so some of the initial presentations they had were frustration with communication, and these are all reported by the parent and the therapist, speech therapist. Difficult to understand, grazing on food throughout the day, a very picky eater, having headaches, had been diagnosed with ADHD, very sensitive gag reflex, a history of reflux as an infant, and was on medication before, no longer on medications now, snoring, bruxism, open mouth posture, history of painful and nursing in a shallow latch as an infant, and they could not hold a pacifier as an infant. So 6 years old. And again, here's our kind of case throughout. And so for this one, you can see a lingual restriction here, a little bit restricted on the upper maxillary labial frenum. We did a release. For this one, we put less sutures, but we ended up putting a little bit of what's called periacral glue to help support the wound closure during the healing process. So we were able to close this with less sutures than maybe needed, but still get a good outcome. And this is a 6-week follow-up of both. So big improvement, and this is still in the early window of all the benefits that it could be having. And so this patient was pretty excited and having good results. And we're going to get to some patients who gave us some feedback that you'll hear about from the families as well. 8-year-old patient is the next one. Patient was in speech therapy and also doing myofunctional therapy leading into this appointment. And this patient was diagnosed with maxillary, restricted frenum and buccal as well. So this one was good to get to show you guys kind of how the buccal frenums can be restricted as well, and then a lingual frenum as well. This patient was having a difficulty being understood, stuttering, slow eater, and open mouth posture. So these are photos. First one on the left is beforehand, and so this one I felt was good for you guys to be able to see how sometimes these buccal frenums can be pretty tight and attaching down low. And we're not releasing just because of the location of the attachment or because we feel it's tight, but we're also going based on the assessment of the speech therapist or myofunctional therapist, kind of doing a functional evaluation. So we're working hand in hand with the therapist and making sure there's reason to release these. And so for this patient, we found that it would have been beneficial to do all 4. And so we did. This is the immediate post-op. You can see kind of that band of buccal frenum has been relieved, and there's nothing attaching closer down near those erupting teeth. And then you can see 6 weeks later, the buccal frenums are virtually non-existent in this photo, but we do anticipate you should form a new frenum. Just it might take 6 to 10 weeks out after until we start to see that. And lingual frenum, nice release of that. It's healing really well. 6 weeks out, patient was feeling great. 36-year-old, this patient was very complex medical history. This patient came from about 3 hours away. This patient was also diagnosed with sleep apnea. The patient had fibromyalgia, which was diagnosed in 2020, chronic pain, irritable bowel syndrome, and a class 3 lingual frenum. The patient reported with having mumbling and speaking very softly, a lot of neck and shoulder pain, headaches, migraines, TMJ pain, clicking and popping while opening, reflux, constantly altering their position while sleeping, and waking up pretty consistently tired and not really feeling refreshed. They also had orthodontics previously when they were younger for about 3 years. Patient currently uses a CPAP. So this is patient, at the point where they're using a CPAP, this is a patient that has needs beyond just a release of a frenum. And so there's other things going on, with sleep apnea that need to be addressed as well. However, we were able to treat this patient and I'll kind of show you. This is the release before and after. Um, Pretty good restriction. The patient did an excellent job being really compliant with their therapy. And this patient, even at the 1 week mark, and now this is 6 weeks later, but at the 1 week mark, started noticing dramatic changes in their pain level and sleep. And so by the time we got to 6 weeks, we got such good feedback. This patient was just blown away by how much more relaxed they felt and how much more comfortable they were getting in their sleep positions. And their hope was they're going to continue to address kind of breathing and other airway issues and maybe kind of retest for sleep apnea and see if their breathing was changing enough with the appliance he was using to just maybe use an oral appliance and maybe be able to get off the CPAP. While the CPAP has been so beneficial, his goal was to try to kind of get to a point where he wasn't so reliant on it. So this was really, really awesome case. The pain specifically and tightness in the neck, back, and upper body was so relieved, and with body work and chiropractic care and the release, it was a great outcome. I think there's one more, and then we'll get to some patient feedback as well. So this patient's a 5-year-old, had 2 months of speech therapy. The parents' concerns were breathing, airways, eating, and speech. They had body work and frenectomy as a newborn. The initial presentation, they had speech concerns, a slow and picky eater, snoring at night, sleeping with their mouth open, and previous difficulty with breastfeeding. This one, you get to see kind of how things look over 3 visits. So the initial visit, pretty restricted lingual frenum over here. You can see the release and then completing the functional frenuloplasty. You can see a 6-week follow-up, good wound healing, good elevation. And then at 12 weeks, you can see a pretty remarkable suction hold, great elevation, which improved even more from 6 to 12 weeks. You can see how wide the patient's opening, floor mouth is staying pretty relaxed, and a really good mid portion of their tongue being able to elevate and sit into the palate. So that was a really exciting one. All right, these we'll start to hear some patient feedback at a few different age groups. So the next patient is a 5-year-old. This one had trouble producing sounds, slow eater, didn't finish their meals, packing food inside the cheek, very hyperactive, difficulty with attention, waking up easily, also not waking up refreshed, and sleeping with their mouth open. So this patient, you could see the before, immediately after, and then once we had closed things up, history of some cavities, difficulty with brushing and cleaning the teeth. And then this is 6 weeks after. And so this is the patient and their parent giving us some feedback a few months after of how they felt like things had gone and how things had improved. And so hopefully you guys can hear this just to see how this procedure which was about 15-minute procedure, obviously with some commitment to myofunctional therapy and the whole process, but this patient did all the right things and just had so many improvements. I'll let you listen to this part. Sorry about that. All right, so great feedback and a great result. Our next patient is a 14-year-old, history of speech therapy for about 2 years. This patient presented with frustration with communication, having a difficult time being understood, trouble specifically with TH sounds, and diagnosed with a class 3-4 lingual frenum. So pretty restricted here. This is before, immediately after, during, immediately after, and then a 6-week follow-up. You're kind of getting the gist of the outcomes we're anticipating, and at 6 weeks, we're hoping to see improvement. However, the journey doesn't end, and we can continue to see improvement. So 6 weeks, we're hoping to start to see some good improvement, but we can see continued improvement 6, 8, 10, 12 weeks out, and sometimes even longer, depending on the age of the patient and their kind of commitment and compliance to therapy. So this is a little feedback from the patient's parent. This is a 14-year-old, so a lot of speech early on. They ended up with a therapist that they worked with, and then as a 14-year-old who became educated on myofunctional therapy and the impacts of tethered oral tissues, revisited the same therapist who now felt more comfortable. So that's just to cue you in that you're learning things that you maybe didn't see before, but this therapist got educated and became more and more comfortable. And we worked with them together as a team and helped treat a patient they had previously treated, and now got them over some major hurdles that they didn't get through, about 7 to 8 years before. So here's the parent feedback on this one. Awesome story. Really cool to see kind of the providers getting educated and being able to help a patient they helped previously as best they could at that time, but not knowing what they didn't know. Now learning new things and being able to really help them over some big hurdles. And now we'll look at an infant. So this patient is a 3-week-old, born full term, exclusively being breastfed. Patients came in stating that the lip looks tight. The lips sometimes what you're going to hear about early on because it's easiest to see and it's a little more difficult to assess and see under the tongue. Presentation while nursing, it was painful while nursing. They noticed a shallow latch. Patient was having poor weight gain and milk dribbling out of the mouth while feeding. So this is a before and immediately after. So the patient, while they came in reporting just the lip, we noticed kind of the mid portion of the tongue, a little further back from the anterior, being restricted. And so while they came in just noticing the lip, we found that most of the nursing challenges and some of the concerns were likely due to the impact of the tongue. And so we did the release on this patient, and now we saw them a few weeks later. And so this is the parents giving us some feedback on their experience. All right, so that was an infant one for you guys to see. And I think we have a couple more that we'll look at with some patient feedback, 2 different ages again. So this is a 6-year-old. This one was interesting because this patient had a previous release with scissors as an infant, which we see often in our practice. They were a slow eater. The myofunctional therapist they were working with had done some measured evaluations of their TRMR and tongue to incisive papilla. So they were 44% for that. Their LPS, TRMR and LPS was 38%. They had a noticeably vaulted palate. They had low tongue posture. They're in speech therapy due to some speech errors. and then a noted improper swallowing pattern, and that was by their speech therapy evaluation as well. So this one, you can also see a 6 and 12-week follow-up. And this one's kind of interesting just to see what do we hope to see over time in those months. And so this patient worked really hard to get a good suction hold. They spent months and months with their therapist working on that. We did the release. 6 weeks after, you can see some inflammation around the wound site initially, but really good elevation compared to the pre-op. And same here, a good suction hold. Still a little bit of thickness in the tissue that had healed. But 6 weeks later, with continued work, you can see kind of in the midline here, in that kind of thickness had gone down, and they're getting such a good suction hold. If you kind of compare the 6 week of where the mid portion of the tongue and where this is attaching, how high up that is into the palate, and versus this one, you can see great suction hold all the way up into the palate. Patients still might benefit from some orthodontics, but got a great suction hold and tongue position. And this is the parent giving us some feedback. All right, one more. 3-year-old. Again, awesome to hear great feedback and just how you can impact these patients in different age windows in different ways. Another 3-week-old, so an infant who's already seeing a lactation consultant. This patient had already committed to this process and was had some craniosacral therapy done. We diagnosed a class 3 maxillary and mandibular lingual frenum. They noted frustration while feeding, grazing throughout the day while feeding, choking or gagging when they were feeding. They were using a nipple shield. They couldn't feed without it. Had poor weight gain, painful nursing, and a shallow latch. So we'll see this one. Same, we did lip and tongue for this one. You can see the before and immediately after. And then we'll hear about the patient's feedback. So 3-week-old, and just really cool to see the impact. All right. So that was kind of the last case we'll delve into deep. Hope you guys enjoyed those, and I really hope you can see just the impact in different age windows. I wanted to show you this slide. This is just a little teaser of some things that we'll maybe share cases on in the future, but what other things we're up to help these patients. And so we're helping do early expansion. These are a couple 3-year-old patients that we've helped expand. It's not easy to find many people who are willing to or comfortable or believe in giving these patients an opportunity early to expand their palate to help improve the development of their arch and mouth and breathing opportunities that lie ahead. And so these are patients that are 3 to 4 months into treatment. Actually, the one on the bottom left here, completed treatment. This was a 3.5-year-old, chronic snoring, sleep disturbances throughout. And you can see they had, I think it was about 7 to 8 millimeters of expansion in that 2 to 3 months. And then they held that position with a retainer, and now they are out of it and have had no snoring, which has kind of stopped about a month into treatment. And then this is another patient who's still in retention, meaning they're holding the new position, which we'll kind of share these at a future date, maybe in a future lecture. Again, but expansion and identifying early issues that can help accommodate tongue position and breathing and growth and development. Catalog, I may have mentioned in a previous lecture, but Kenalog is a steroid injection that has been kind of supported in recent research to help break up scar tissue fibers in previously released patients who may be having excessive tension, whether it was that they had scar tissue buildup because they were susceptible to it, or if compliance wasn't so great and they need a little help loosening things up so they can continue or resume with their therapy. So we found putting some Kenalog in there with kind of a specific protocol has helped lubricate and kind of break up the scar tissue fibers. And if patients are compliant, we've seen pretty quick loosening of tension and improvement in their ability to resume therapy. So pretty excited to see that we have another tool in our toolbox to help patients who maybe had treatment 6 months ago or 2 years ago and are back and wanting something to help support them to get resume some therapy. So those are some things to be on the lookout for us ahead. Conclusions from this: there's clearly benefits throughout the lifespan, and that's from a newborn through adult age into geriatric population. And so we've treated patients as kind of far as about 70 years old. Really no limitation on it. It really depends on their impact and what they're looking for. And as early as 2 days old. So we see patients throughout the lifespan. They can all have different compensations and different things impacting them. And so I just reiterating that there can be benefits, and the benefits can be different in different windows and phases of life, and that this is something that's worth kind of understanding, getting educated on, and realizing the impact you can have on these patients, no matter what patient population you treat. Encouraging everybody to continue to get educated. If you're watching this and you're in Simon Says, you're clearly committing to this process and to understand that the journey never ends. So I've been fortunate to kind of speak to you guys and some of you for more than one time. And part of that is I'm continuing to commit to the education process and trying to kind of pay that forward and share that with you guys. So realize that what you're using and the tools you have and while you're treating your patients now will continue to evolve, and you'll continue learning and seeing things you didn't understand or know, and you'll see that you're just evolving with the process and the education out there and helping better treat your patients. And that's what it's all about. And then being a team player and know your limitations. So I don't do any of this by myself, not only clinically in our office, but also as far as the patients who are being treated with other providers outside the office. All our patients are using a multidisciplinary approach, whether they're working with therapists, lactation consultants, body workers, ENTs. So we're working with multiple providers on every patient. And so that takes willingness to be a team player and work with others, and also knowing your limitations. You're not going to know everything, and you're not going to be comfortable or educated enough or comfortable to treat everything yourself. So know your limitations. It's a good thing. It's not a thing that's holding you back. Being able to identify is kind of the first step, and then knowing who to refer to and when is kind of the next. And then you start to delve into where you play into the role of this process. So knowing all of that. I'm going to leave you guys. I'm just going to click through because I think you guys will have this recording for some time, maybe a month or two for those taking this. I'm just going to click through before I leave it on the summary page, on the closing page, of cases that you can pause and look at, because all cases are different. The tissue attachments are different. The releases are slightly different. It's really patient to patient. And so if you want to pause and look at things and just see how I did things differently, I'll let you do that. I'll still talk while I click through these extra cases, but this is just like icing on the cake for you guys. I just thought I'd share. Why not? I didn't do full case reviews, but for these, I don't want to talk your ear off, but good cases, different ages, you can see at the bottom, pretty predictable outcomes. So big change in restrictions. Some of these patients are super tied. So as I continue to click through these, and you can pause and watch them at any point. A lot of you I've worked with before. If I haven't, feel free to email me. I'll put my info up at the end of this. Again, super grateful to Jay and Simon Says, and you guys are part of a great educational journey. I look forward to working with some of you. Be on the lookout. We have some other new ventures ahead besides the expansion in Kenalog and spaces and things we're going to do to help our patients, and you'll probably hear about in the coming months. There's Zen, our therapy dog, keeping our patient comfortable, cuddling up a little bit. But a lot ahead. I'll put my contact info on here if you want to email me, introduce yourself, kind of let me know where you are, or share some cases, or just come by and meet. I'm happy to do so. And then our social media pages at the bottom on Instagram, sometimes Facebook. We share a lot of our stuff. You can kind of follow our team. Here's my contact info. Thank you guys so much. I hope you guys enjoy the rest of the lectures and all the great providers on here. And I look forward to connecting with you guys. Thank you.
All right, my child is 14 years old. Improvements that I noticed, he was able to move his tongue a lot more freely. It wasn't tethered. And by doing that, he's able to move or not put as much tension in his jaw. So his jaw isn't compensating now because his tongue is free to move and do the movements, the natural movements that it's supposed to do. And the experience was great. It was unbelievable how easy it was. Everyone here totally confident and was able to do it quickly, and he suffered minimal pain. He was in and out, went to school the next day, and it was really all around a great experience. We wish we would have known and done it earlier.
Okay, ready?
Yeah.
Hi, my name is Jen, and this is Gabriel. And Gabriel had a frenectomy with Dr. Armakan about, I don't know, within the last year. And he did myofunctional therapy to get ready, and then he had his frenectomy, and we've seen so many improvements since then. He is sleeping better. He's closing his mouth when he's sleeping. He's chewing better. He's not pocketing his food in his cheeks. What else is going on with you? I'm trying to remember.
I do not know.
You don't know. he's just doing so much better overall. I can see better breathing, better swallowing, better chewing. He's waking up more rested, and his tongue can clean his teeth. He started getting cavities, but he's had a clean bill of health since. So we're so happy
Well, I
that we
got
got. I know you did. That we got to see Dr. Armakan for that.
Hi, my name is Caroline Davis, and this is James. He's 3 weeks old, and he's my third child, and my second child nursed very well, and he was having a lot of trouble. So we came here and got a lip and tongue tie released, and we saw almost immediate results. I'm really happy with the fact that we decided to do the procedure, and everyone here who helped make it possible for him to be a successful nurser. Thank you.
Hi, my name is Danielle Gerstner. My son Patrick Gerstner had his tongue tie released. We're so happy with the results. He's 6 years old, and when he got it released, he immediately started talking better. He was able to lift his tongue better. His eating got better. We're very happy. Dr. Eric is amazing, and his team is incredible. So thank you all.